It is a common process for viruses to mutate. However, what isn't normal is when one strand alters itself more than a dozen times. As of this month, there have been 2 new variants detected in the nation and 2 confirmed cases of one of those variants here in the Commonwealth.
What's unique about this strain is that there are about 14 mutations that have happened all on one virus, which is an unusual number of mutations.
According to health officials, a man in his 20s from Worcester County has been confirmed by the state laboratory as the second resident with the UK variant. Dr. Catherine Gergen-Barnett from Boston Medical Center explains the variant can be more transmissible, but could potentially be deadlier too.
We are not at all certain that the greater severity of disease is true or validated, but there is a rising concern that has come out of the UK over the last 2 days that, in fact, this variant might be what is considered more deadly.
While the variant is still being analyzed, some promising signs are emerging that the vaccines from Moderna and Pfizer could be effective against these and future variants.
So I think one more arrow in our quiver will be if these new variants arise and if the vaccine that we're currently using isn't as effective against them, both of those companies can reproduce vaccines pretty quickly that allow us to adapt.
Although the state's vaccine rollout plan has proceeded more slowly than anticipated, according to Dr. Gergen-Barnett, the new federal plan is a welcome change.
We have been very hungry for a federal response, and we are thrilled that there will now be a federal response that we can lean on, and every state can have some sort of organizing set of principles and have that be cohesive.
Doctors agree that as the vaccines continue to roll out, the normal protocols of wearing a mask, staying 6 feet apart, and washing your hands are still vital in keeping everyone safe. For ACMi News, I'm Maxime.